I got the phone call November 12th at 2:39 in the afternoon. That specific time is forever there.
The details differ, but the outcome is always the same. A judge who lost a brother.
And he goes, well, I love you, Mark. And I was dead silent. I wouldn't say it. And that was the last time I talked to him.
A prison guard who lost a son.
I woke up at 6:30 in the morning hearing my wife scream. Thad, wake up, Thad, wake up.
A sister who lost not one, but two siblings.
I lost my other brother in 2014.
All of them victims of the opioid crisis.
I would give anything to go back in time.
Every month, Tina Snyder meets with a grief therapy group in Williamsport, Pennsylvania. Together, they ask the questions that haunt them. How did this happen?
What the hell are you even here for?
How did it get so bad? And most importantly, why?
I mean, to us, we'll never have real answers.
There's no peace.
No, there isn't.
While this northern Pennsylvania district was reeling from an opioid crisis, its representative became an ally of big drug companies. In 2014, Congressman Tom Marino introduced and sponsored a bill that current and former Drug Enforcement Administration officials say weakened the agency's ability to stop the flow of pain pills.
Why are these people sponsoring bills when people in their backyards are dying from drugs that are coming from the same people that these bills are protecting? And that's a question you need to ask them.
The House will be in order. Without objection, the bill is read a third time and passed, and the motion to reconsider is laid on the table.
4069, the Ensuring Patient Access and Effective Drug Enforcement Act of 2014.
The bill was the result of years of lobbying by the drug industry, aided by sympathetic members of Congress.
My legislation would encourage more collaboration, the operative term there, more collaboration between DOJ and legitimate companies trying to work with you to prevent prescription drug abuse.
It watered down DEA's authority to go after wholesalers, manufacturers, distributors, and it weakened their authority to go after pharmacies.
Joseph Ranazizi ran the DEA's division responsible for regulating the drug industry.
What they do, but that very small percentage of doctors that have crossed the line are truly hurting a lot of people. I can't.
This made the whole crack epidemic look like nothing. This was people who should have known better, professionals who were just writing prescriptions, opening clinics, and selling drugs illegally in mass volume. They were just drug dealers in lab coats.
The agency's most effective tool in dealing with these companies had been an immediate suspension order. This allowed the DEA to lock up opioids and other drugs if manufacturers, distributors, or pharmacies failed to report suspiciously large orders of drugs. But a few words in the new bill changed that completely. The agency now had to prove there was a substantial likelihood of an immediate impact on the community.
And there's no way that we could meet that burden that those drugs are going to be an immediate threat, because immediate, by definition, means right now. It means it's going to happen right now, and we couldn't meet that.
Counter number 368, S483, a bill to improve enforcement.
It basically wrote a law that protects industry, and if people die, well...
Is there objection to proceeding to the measure?
Too bad.
Without objection.
Since the bill has been signed into law, the number of deaths from opioids continue to skyrocket.
Gentleman from Pennsylvania is recognized for 3 minutes.
Marino is now President Trump's nominee to be the nation's drug czar. The Washington Post and 60 Minutes reached out several times to Marino. He declined to comment.
I just don't understand why Congress would pass a bill that strips us of our authority in the height of an opioid epidemic in places like Congressman Marino's district.
But drug industry officials defend the law as an effort to ensure that those who legitimately need pain medication receive it without disruption. Since 2014, 106 people have died from opioid overdoses in Marino's home county. This past September, over 500 people came out to run and walk for an anti-drug fundraising event. Many here know someone who is either an addict or has died from an overdose.
Did you register?
Yep.
Under Lee's team?
Yeah.
Yeah?
Nice. I didn't know you did.
Yeah, this is my boyfriend, June.
Tina's son, Lee, became hooked on opioids after his senior year of high school.
The week after he graduated, he was hospitalized for 2 weeks with diverticulitis. And I believe that's when his addiction started, because he was on some really strong pain meds in the hospital. And then 3 years ago, his half-brother died from a fentanyl overdose. And I think that's kind of when it just went downhill for him.
Lee lost his job, his girlfriend, and his car. Heroin, cheaper and easier to access, became his drug of choice.
He was dope sick, is what he called it. And then that's pretty much when he begged me and his sister to get him help, that he didn't want to die.
Lee went in and out of rehab for several months before eventually moving in with his sister.
The first month that he was with her, he didn't even go out of his room. And I think it was, because he didn't want to be tempted.
But last November, Lee left to meet up with a group of old friends. He never came back.
And I got the phone call at 2:39 in the afternoon. And all I remember hearing is, Miss Snyder, this is Chuck Kiesling, the Lycoming County coroner. And at that time, I just started, I could literally feel my heart breaking. And I didn't say anything. And he goes, we found your son this morning around 7 o'clock in the morning. And I just kind of like melted to the floor, started crying. And the girl I was working with took the phone and was talking to him. And I just kept begging her to tell me that it wasn't true. You think that, get him into recovery, get him clean. You think that that's going to be okay, but it's not. It's a struggle and it's a battle, even afterwards.
I always thought people had a conscience and people would do the right thing because that's what the public demands. You do the right thing. But after this whole incident with the Ensuring Patient Access Act, I realized that people are right. Lobbyists do control the House and the Senate, and they do get things through what they want. And as long as they've got the money and major corporations behind them, the sky's the limit.